Hi, I'm Ellie from the Suffolk Sexual Health Service, and today I'm going to talk to you about sexual pleasure. When we think of sex, our minds tend to go straight to the factual concepts, such as contraception or STIs, as this tends to be what we're taught in schools. But the discussion around pleasure is one that we don't hear that much. This can be due to it being a topic that can make people feel a little bit uncomfortable, curriculum restrictions, being seen as inappropriate to talk about in schools, and more. But pleasure doesn't have to be something that we're scared to talk about, as realistically, it's one of the main reasons why people have sex. It feels good. The body releases feel good chemicals during sex, and many people enjoy the sensory experience of touch, arousal, closeness, and orgasm. These chemicals can include dopamine, which creates feelings of enjoyment and acts as a positive reinforcement, increasing our desire to repeat the experience. Another is oxytocin, which bonds people and helps to support emotional connection. Therefore, levels spike during orgasm and skin to skin contact. Serotonin is also released from the brain during sex, which supports emotional well being and contributes to a sense of happiness and relaxation afterwards. The last we will mention are endorphins, nature's painkillers and mood elevators. The effect of the release of this hormone are pain reduction, inducing euphoria, and promoting a sense of well being. It is important, though, that we speak about pleasure and sex. As uncomfortable as it may be, the more we speak about it, the more normalised the discussion becomes. This then leads to people having more informed, safe, consensual, and pleasurable sex, where they can easily talk about what they do and don't like and their boundaries. It's also important that we consider those who do not want to have sex. This is known as being asexual, where people experience little to no sexual attraction or impulses. People who identify as asexual can have perfectly normal romantic relationships, just without the sexual elements. Communication is so important in terms of pleasure. Everyone's desires are different, and people like different things in different ways at different times. Without communication, partners might assume or guess wrong, which can lead to discomfort or disappointment. Saying things like, that feels good, can you go slower? Or I like it when you do that, helps guide the experience. Giving or not giving consent relies on constant communication, as it isn't just a yes or a no, it's an ongoing dialogue. Good communication makes sure people feel safe, respected, and in control, which creates the emotional freedom to enjoy themselves. Without communication, sex is guessing. With communication, sex and intimacy becomes a shared, personalised experience, which is when real pleasure is achieved. Touch stimulates nerve endings and sends signals to the brain that release dopamine, oxytocin, serotonin, and endorphins, those chemicals we spoke about that create pleasure, bonding, and calm. In other words, touch can feel good emotionally and physically, even outside of sexual contact. Gentle, exploratory, or erotic touch increases blood flow, sensitivity, and tension, which are all necessary for sexual arousal. It helps build desire rather than jumping straight to the act, which often leads to more satisfying sex for everyone involved. Touch isn't just about sensation, it's about feeling wanted, safe, and seen. Even non sexual touch, like cuddling or hand holding or caressing, increases emotional intimacy, which can enhance sexual pleasure. But pleasure isn't just sexual, though. There are many ways that we can feel pleasure that aren't reliant on other people's touch, such as feeling the warmth of the sun on your skin or sinking into a comfy bed, watching the sunset or smelling freshly cut grass, or even things like helping others and feeling proud of yourself. Pleasure is not just about sex, it's about the little and big moments that light up your senses, heart, mind, and body. This is the part where some people get a little bit squirmy. There are certain parts of the body that are especially sensitive to touch, temperature, pressure, or vibrations. These are called erogenous zones, and when they're stimulated, they can create sexual arousal and pleasure. Some of these are the genital areas, such as the clitoris, vulva, vagina, penis, and scrotum. Kissing, sucking, or even breathing near the lips can be arousing, as well as the nipples and breasts, inner thighs, neck, and ears. Due to the amount of different erogenous zones, it's important to know the names of the body parts so that people having sex or being intimate can communicate exactly what they're comfortable with. There are lots of different parts which make up the different types of genitals. External male genitals include the penis, which is the main external sexual organ and is made up of three parts: the shaft, the glans, and the foreskin. The penis becomes erect when aroused due to increased blood flow and contains the urethra, which carries urine and semen out of the body. The scrotum is the pouch of skin beneath the penis, which holds the testicles and helps to regulate temperature for sperm production by moving closer or further from the body. The female genitalia has more components. A common misconception is that the vagina is the correct term for all of the external parts. However, the correct labelling is actually the vulva. This consists of the mons pubis, which provides cushioning during sex, the labia majora, which are the outer folds of skin that protect the inner parts and may be fleshy or thin, and appearance varies widely. The labia minora, which are the inner folds of skin, which contain many nerve endings and is very sensitive to touch. The clitoris, which is the primary pleasure organ with over 8,000 nerve endings. Only the glans is visible, and the clitoris includes internal roots and extends several inches inside the body. The function of the clitoris is to provide sexual pleasure and to facilitate orgasms. Stimulating of the clitoris can make someone feel sexually aroused. It can heighten feelings of sexual tension, which could lead to climax or orgasm. Even if you don't have an orgasm, the sensations from a stimulated clitoris usually feel good, and this can be touched with fingers, a toy, or a tongue, known as oral sex. Some people who have vulvas may release a fluid during clitoral orgasm. This fluid is not urine and comes from the Skene glands, which are located near the urethra. It is a normal variation in sexual experience, and not everyone will experience this. There's also the clitoral hood, which is a fold of skin that covers and protects the clitoris, the urethral opening, where urine exits the body, and the vaginal opening, which is the entrance to the vagina, where menstrual blood exits, penetrative sex can occur, and where babies are born from. Vague or slang terms can lead to confusion, especially in sexual settings or during consent conversations. You can't fully enjoy or explore your body if you don't understand how it works. Many people, especially those assigned female at birth, aren't taught what a clitoris is, where it is, or that it is the primary organ for sexual pleasure. Knowing the parts of your genitals and what they actually do builds confidence, body literacy, and pleasure potential. Experimenting with different types of touch by yourself or with a partner can help you familiarize yourself with the types of sensations that feel best for you. By experimenting, it can help you to maximize the pleasure you're feeling, especially when involving the G spots. The male G spot is commonly considered to be the prostate gland and is located about 2 to 3 inches inside the rectum on the anterior, so the front, wall towards the belly button. It's roughly the size of a walnut and can be felt as a firm, round bump through the rectal wall. The female G spot is an area located inside the vagina that can produce heightened sexual pleasure when stimulated in some women. It is located about 1 to 3 inches inside the vaginal canal on the anterior, front, wall towards the belly button. It may feel slightly rougher or rigid compared to the surrounding tissue and is often described as having a spongy or firm texture when aroused. Masturbation is important for pleasure because it's one of the most natural, safe, and empowering ways to explore your body. You can understand what feels good and experience sexual satisfaction completely on your own terms. Masturbation lets you discover your own turn ons without pressure or performance, as well as it being 100% consensual, safe, and in your control. Masturbation isn't dirty or something to hide, it's part of a healthy sexual life, whether you have sex with others or not. It teaches you that your pleasure matters, even without a partner. If you do choose to masturbate, though, it's important that you do this in a private space, as masturbating in front of someone else without their consent is a sexual offence, so avoid this at all costs. When things are very pleasurable, this can lead to a sexual climax, also known as an orgasm. An orgasm is a peak of sexual pleasure that often leads to ejaculation for people with penises and can result in contractions of the pelvic floor muscles, uterus, and vaginal walls of people born with vaginas. It involves muscle contractions, brain activity, and hormone release. Not everyone orgasms from penetration alone, as clitoral stimulation is the key source of orgasm for most people with vulvas. Orgasms vary widely, from intense and whole body to gentle and focused or to emotional and energetic. A person can feel pleasure and connection without orgasming, and that's valid too. Everyone is different and likes different things, so it is always best to have conversations about likes and dislikes first, to make sure that your partner or partners aren't doing things that make them feel uncomfortable. Talk openly about likes, dislikes, fantasies, and boundaries. Use verbal and nonverbal cues during intimacy to guide each other and set the time with consent focused, respectful dialogue. Experimenting with new things can also help to enhance sexual experiences, such as different positions where you can try different angles for new sensations. You can use toys like vibrators, rings, plugs, or couples toys to add variety, as well as exploring various kinks such as gentle forms of BDSM, restraints, or role play if interested. It wouldn't be a chat about pleasure and sex without me mentioning contraception and sexually transmitted infections, would it? In terms of pleasure, if someone is having safe and protected sex, using contraception can actually help them relax and have an overall more pleasurable experience, as they know their risk of pregnancy and or contracting an STI is significantly lower. Contraception is everyone's responsibility, as people of all genders can be part of the conversation by using internal or external condoms, which create a barrier from the exchange of bodily fluids and therefore prevent pregnancy and STIs. People can also get vasectomies or simply support their partner's choices. Using condoms can enhance pleasure, and some condoms come with lubrication to reduce friction and are available in different textures like ribs and dots and have thin designs for more sensitivity. Using additional lubricants, not just those on the condom, can help to enhance pleasure and also make sex safer due to less friction. Condoms also come in different sizes and in latex free variants, so there is a different type for every individual. Condoms protect your body, your partner, and your peace of mind. They're an easy, effective way to make sex safer without taking away the pleasure, and you can get them for free in Suffolk. You can access free condoms from the age of 16 to 24 in Suffolk through the EC card scheme. All you need to do is download the app, watch some videos, answer some questions so we know you're having informed, consensual sex, and you're good to go. If you are 13 to 15, you can still access the EC card, but you would need to have a face to face consultation. To find your nearest EC card assessor, you can call 0300 303 9982. You can collect up to 10 condoms a week throughout various distribution points in Suffolk. Just go on the app and find your nearest one. If you are over 24, don't worry, you can still access free condoms. However, this is through the Suffolk Sexual Health Services Personal Health Record, or PHR. By creating an account on our website, you can then take control of your sexual health. Through the PHR, you can do things such as book sexual health checks, order free test at home kits, receive your test results, book contraception consultations, and of course, order your free condoms to be delivered to you. If you require a sexual health screening, please do not hesitate to book an appointment through the PHR or by calling 0300 303 9982. So, this ends our little chat about pleasure and sex. As I've said, this shouldn't be a topic which is never spoken about, as it is so important. I hope this video has helped you to know a bit more about your bodies and pleasure, and to reiterate how important it is that if you are having sex, it is enjoyable and comfortable, and most importantly, safe and consensual. If you would like to know any additional information or feel as though you need extra support about anything mentioned today, please visit the Suffolk Sexual Health Services website. Thank you for listening and take care.